I rise to give notice that on Wednesday, 15th April 2026, I'll move that this House, concerned by the growing prevalence of Alzheimer's disease, dementia, and related neurodegenerative disorders across sub-Saharan Africa, which remain underdiagnosed, underrecognized, and underreported due to limited awareness, stigma, and a lack of structured national responses. Disturbed that Zimbabwe, like many nations in the region, is experiencing a demographic shift with the growing elderly, and yet there is no comprehensive public awareness campaigns, national dementia policy, or specialized support systems to assist families and communities affected by these cognitive conditions. Noting that with despondency that Alzheimer's disease report, there are currently over 3 million people living with dementia in sub-Saharan Africa, and this number is projected to triple by 2050 due to increased life expectancy, urbanization, and the changing lifestyles. Alarmed that despite this projected growth, more than 75% of dementia cases in Africa remain undiagnosed, and that persons living with Alzheimer's disease and related disorders often face social exclusion, misdiagnosis, and accusations of witchcraft, particularly in rural areas, as communities lack basic knowledge about the symptoms and the progression of such conditions. Further concerned that family caregivers, often women and young people, shoulder the emotional, physical, and financial burden of care without proper support services, training, or psychological assistance. Inspired by global trends where nations have developed national dementia plans in line with the World Health Organization's Global Action Plan on the public health response to dementia for 2017 and 2025, which advocates for awareness creation, timely diagnosis, caregiver support, and research. Now, therefore, this House resolves that A, the Ministry of Health and Child Care, in collaboration with the Ministry of Public Service, Labor and Social Welfare, and the relevant stakeholders, urgently prioritizes public awareness campaigns, demystifying Alzheimer's disease, dementia, as related conditions across all provinces. B, the government establishes a national dementia strategy in alignment with the international standards to guide diagnosis, care, rehabilitation, research, and caregiver support. C, the Ministry of Primary and Secondary Education incorporate basic education on geriatric and mental health into school curriculum to foster empathy and early understanding of aging-related health conditions. D, Parliament calls for the strengthening of community-based healthcare systems to include training for health village health workers, on recognizing early signs of dementia and providing frontline support. E. The government partners with private sector, academic institutions, and civil society to invest in research and data collection on the epidemiology of dementia in Zimbabwe for evidence-based policy making. And finally, a National Dementia Awareness Month be proclaimed annually to promote nationwide dialogue, cultural destigmatization, and engagement with traditional healers and the churches. So I move. Thank you, Madam President.